My name is Lucia Nadaf. I work for Orbis International as Country Director for Zambia. So basically that's managing a portfolio of where we have comprehensive eye health, pediatric eye health. We have a focus on adult cataract, as well as trachoma prevention. And we're also running a program focusing on human resource for eye health. Basically, this is training upcoming ophthalmologists, as well as strengthening the faculty for them to be able to deliver quality ophthalmic training. Actually, I've been with Orbis for 5.5 years now. So my background, basically, I was working in the HIV sector, working with a number of organizations, so both local and international. So me coming to the eye health was, I actually remember getting this job and I was thinking, do I really want to do this? But I took it as a challenge, and especially that I had to move from my home and go to this other place where I was going to work from. So it was a bit daunting, but I decided to give it a try. And after a couple of months, I was hooked. Basically, the interesting work that we do, basically saving sight. And for me, I think the difference was also coming from HIV, where you focus mainly on behavior change, and that takes time because it's individual choices. But to see immediate results, sight being changed, a patch being taken off, and someone being able to see was just amazing. And I stayed. And here I am. So I basically worked as project officer on one of the projects. It was actually a DFID funded project, and I acted as country representative for Orbis in 2018, basically for about 9 months, and then I was confirmed to the position of country director till now. So as you know, Orbis is an international charity, and our focus is treating blindness as well as preventing blindness. So we work with ministries of health in the countries where we work. We work in Africa, Asia, Latin America, and the Caribbean. And we work with the ministries of health, basically building their capacity for them to be able to provide quality eye health. So capacity building and system strengthening. So this includes training for eye care teams, provision of equipment, as well as medical supplies. And then we also go further where we work with communities. So we are not able to do our work without the communities that we work with, because all the figures that we would report on, the eyes that we treat, those are people, those are families, people coming from families. So we do engage communities as well in the work that we do. So Orbis has been working in Zambia for a little more than a decade now. Actually, this is our 11th year. We started our work in the northern region. So it's an area called Copper Belt. So basically we work in 3 provinces out of the 10 provinces of Zambia. And we started our work at a tertiary facility. Back then it was just a unit. It now gained the status of an eye hospital. So basically, we supported pediatric eye health services there, where we set up child eye health tertiary facility, quite a mouthful, but we started with basically training for the ophthalmologists there. For the eye care team, supporting them, the biomedical engineers, and also providing free treatment for children. So children would have free surgery, follow-up, spectacles. But we later expanded our work to the whole province. So basically all the 10 districts in the province. And we started our work with district health care centers. So strengthening where there were centers. So we had a few that were running. We ensured that we provided refresher training for the staff. We provided equipment and an ongoing supply of medical supplies. So we changed in most places where some units were operating from maybe 3 days in a week. So now they're at full capacity, they're operating at full capacity. We also went into districts where there were no centers, and we set up centers. We also worked with the primary healthcare centers. So basically, these are primary eye care facilities where these are clinics that are found in communities. And so we trained the general nurses and clinicians there, basically in basic eye health. So the intention is for them to be able to diagnose conditions and refer where they're not able to treat. And then the district health facilities would also do the same, refer to tertiary level. Also, interestingly, we worked with community-based volunteers. So these ones we train, so they're able to identify cases. So these are the people that live with communities. So they know when they see a child with a condition or an adult with a condition, and they would basically refer them to the local center within their community. So that's one area where we've had a focus on pediatric eye health. So with the skills training that we've offered, the medical supplies, the eye drops, the adults also have benefited from that. So it hasn't just been the children. We also work in another area, which is the northwestern side of Zambia. So basically this side as well, we focus on adult cataract. So we actually ran a long-term project, a 5-year project, which was basically comprehensive eye care. But then we realized that there was a great need among the older population. So we have, this is a vast district, very popular access to health services. So we're having people going needlessly blind. And also we're talking about an older population. They're mainly farmers. They grow food for their own consumption, so they don't make an income out of that. So again, they're not able to afford to travel. They're not able to afford services. So we came up with a project where we basically follow them up. We mobilize communities, we do screening, and then we book them for treatment. And we have teams that go in and provide surgery as well as conduct follow-up. So this province as well is where we have problems with trachoma. So we've also had to run a number of mass drug administration. So the rollout of antibiotics we've run about 4 in 4 districts. So this has also been an area where we've been working in, and we've had support from the Queen Elizabeth Diamond Jubilee Trust as well as DFID. So we've had quite a lot of work being done in the province. We also work in the capital, Lusaka province. So this is where we're working at the University Teaching Eye Hospital. So this is the highest level tertiary facility in the country. It actually attained its status in 2017. So our investment is to ensure that we bring it to the level where it's supposed to be. So with the UTH, we provide training for faculty. We provide support the residency training program. We also provide a specialist training where it could be a 1-year training, for example, like in India, where the ophthalmologist goes to specialize. But then we also provide training through the tools that we have, the programs that we have. So when you asked me about Orbis, so part of what we do is also provide training via our award-winning online platform. It's a telemedicine program, CyberSight. So we have ongoing training using CyberSight. We have the Flying Eye Hospital, where training also takes place. And this is part of what we've been planning to do for Zambia, as well as what we call hospital-based training, where we bring in someone from our volunteer faculty, so a specialist who would come and do hands-on training with our partners here in Zambia. So that's been our focus for the University Teaching Hospital. We are also conducting outreach services. So like I mentioned, working with communities, and also working with communities, we use a number of approaches. So we're not going in to lecture them. It's a partnership. So we create all these platforms and work with structures. We work with traditional healers. We work with traditional leaders. We work with parents, community schools. So that's a very vibrant part of what we do. And we've rolled that out in all the 3 regions that we work in. Definitely. So we do have we have a prevalence of 2% in terms of blindness in Zambia, but that's still huge. Obviously, a person going blind, with just one person going blind, is a big problem. So we have all these unmet needs, and the biggest need basically is lack of trained eye care staff. So we have this is where we're focusing on specialist training, and also specialist training, very important, because we have cases that our regular ophthalmologists are not able to treat. And so this becomes a burden for the government. So we have people that are on waiting lists because they are looking for sponsorship to be sent out abroad. So our government would sponsor people to go to India, for example, or South Africa for treatment, but that's expensive, and also the wait. So someone can wait for months or years, and then, I mean, the condition can't wait. So that's been a challenge, or they'll refer them to a private hospital where it's very expensive, and sometimes the government is not able to cover the cost. So we've had those challenges, and also just a lot of myths and misconceptions. So people do not realize the importance of eye health, even certain things, just simple things as face washing. When we look at trachoma, especially keeping a healthy surroundings, so the whole aspect of the environment. And so basically what we do also translates in us fitting into the strategic development goals, where we're ensuring that, we address issues of poverty, education, where, for example, our school screening programs, we're talking about a child being able to attain an education, which goes further. If you look at it, they'll be able to get an education, they'll be able to get a job in the future, or even that farmer whose sight, they lost their sight, or they're about to lose their sight, and it's safe, so they're able to provide for their families. So yes, we do have a lot of unmet needs based on the specialist training, so basically having healthcare staff. It's also distances to health centers. We've had this, I think it's more like a deliberate effort by the government, where they're trying to take, they're building up rural health centers, taking them to communities, but then they don't have the equipment, they do not have the staffing. So we're coming in to help fill that gap. So it's been really hard working through the pandemic, and obviously it's met the fact that we need eye health services, and basically health services for people. It's brought in the urgent need. It's been really hard for us to conduct our work, especially community activities. So obviously we're not able to work with our communities. We're not able to monitor the work that we do. So we're trying to be safe, providing safety for our staff, for our partners, as well as for communities. So and also the partners that we work with haven't been able to see patients, especially with the first and second waves, haven't been able to see patients as usual, as regular. So they've been able to only address emergency cases. So it also brings back the work that we do. We've done a lot of community awareness, where people, if you have an eye condition, go to a clinic, do not try to treat yourself at home. So because they're not able to go to a clinic or a hospital, they're reverting back to the old practices. So it's basically drawing back the gains as well. So the pandemic has forced us to be more innovative. So we've had to do a lot of work, and since we can't be in the communities with the community outreaches, we've had to ride with the ongoing government programs. So we have child health activities in the northern parts of Zambia, on the Copper Belt, where we've had to include COVID-19, and as well as eye health screening to these child health activities, as well as maternal and child health activities. So we've had to train midwives, and we've had to train general nurses as well in basic eye health. So for them to be able to identify cases, or know what to look out for in a child or in a mother during those programs. We've also had to use a lot of radio programming. So radio is widely used here in Zambia, especially in rural communities. So we've had to use messaging, and again, integrating eye health and COVID-19 messages through radio. We've worked on also material, information, education, communication material. So we've had all these posters that have hand washing and what to look out for in terms of eye health, and also the link between COVID-19 and conjunctivitis. So we've had a lot of people presenting red eyes, when they have COVID. So we've also had to integrate that messaging. Interesting as well, we've had some of our staff working on the front lines. We've had two ophthalmic clinical officers who've been working both on the copper belt. One of them has on the border with Zambia and the DRC. He's been part of the team that has been screening truck drivers coming in from the DRC. And also what they've done is they've been innovative. They've integrated eye health in there. So they screen for COVID, they also screen for eye conditions. We've also got a young lady also on the copper belt. Her center was actually closed for most of the other activities like eye health. They've been dealing with other conditions, but then they made it an isolation center for COVID. So she also was taken off and put on the COVID response. And she too has been working basically screening for eye health as well as COVID-19. So that's been interesting. So we've had to do that basically to get things running. So we're also looking at other areas in terms of working around COVID, because we can't stop our work. And this has been helpful. We've had the transport that we have in the provinces, the vehicles that we've donated have been used for ferrying COVID medicines as well. So that's been helpful. Basically, we've been part of the COVID response as well. Okay, so basically, the Flying Eye Hospital is a state-of-the-art ophthalmic hospital aboard an MD-10 airplane. So Zambia has had one visit of the Flying Eye Hospital back in 2012, and this was focused on pediatric training. We were excited. We had this program which we had planned for May 2020, where we were having the Flying Eye Hospital come to Zambia and focus on glaucoma, vitreoretinal surgery, also nursing, biomedical engineering as well. So we had planned this program, which unfortunately could not take place. So basically, the Flying Eye Hospital program was disrupted. A Bolivian team was undertaking training in the US in Texas, and that had to be stopped. So the Flying Eye Hospital was also supposed to come to Zambia, supposed to go to Cameroon, Mongolia, and India. So unfortunately, that couldn't take place. So we had to be innovative. And basically, we turned the Flying Eye Hospital into virtual training, where we conducted pre-learning for the staff that were supposed to be trained when it was here. So between May and July 2020, Orbis launched 3 virtual Flying Eye Hospital projects for eye care professionals in Zambia. And this was, it in a way replaced the personal training. We are hoping that things clear, we get the plane here, we do our training, but it was really interesting. I think it was also testing how our teams work with the partners. So we had training for the nurses, we had training for the ophthalmologists and for the residents. And I always say this, for me, it was basically seeing the nurses learning together. So, people couldn't get together. They talk about timing and different shifts, but they made it work and they really enjoyed this. And I think for them, they never get the opportunity to have such kind of work together or training. So that was really interesting. So discussions are ongoing. We're looking at 2022, and so hopefully things will be better then. And our staff are still and partners are still excited. So we've had to keep the momentum going as well. So there was this whole big hype about us bringing the plane to Zambia and also using it for advocacy and highlighting eye health as an issue. So we wanted to also ensure continuity, and the virtual training really helped that, because it's kept the momentum going for our partners because they had that training. There's been follow-up. There's also been them taking up more cyber-site courses, being engaged with cyber-site and looking at other areas in terms of learning as well. So we are hoping that we do get the plane to come in 2022, but that's still under planning.